We're going to be learning about sleep disorders today. And as you can see, we have some learning outcomes for this section. You should be able to identify and list the 8 types of sleep disorders in writing, be able to define the 5 different types of insomnia that we're going to be reviewing, and also be able to complete the assignment at the end of class, which is going to be logging your sleep for over a week. We're here because it's important to know about sleep disorders and how sleep disorders can affect your life if you have one. So the first sleep disorder that we're going to go over is insomnia. And insomnia is basically described as a characteristic of an inability to maintain sleep. This may take a form early in the morning, waking in which the individual wakens several hours earlier before you want to be up, and then you're not able to go back to sleep. Also, initiating or maintaining sleep may manifest itself in excessive daytime sleepiness. So by not getting your sleep at night, you're going to be more tired during the daytime, which can affect your work and daily living experiences. So there's 5 different types of insomnia, and one of the first ones we're going to go over is acute insomnia. Acute meaning it comes on all of a sudden. It's not anything you've had for a long time, and this can be for a day or two. It's usually a brief episode. Usually can be caused by a life event. Say you had a death in the family, you've lost a job. Also flying different time zones can also affect your sleeping rhythms. And it usually resolves within a day or two without any kind of treatment. The next one is chronic insomnia. Chronic meaning this goes on and on and on for more than, usually lasts more than 3 nights per week, that has gone on for 3 months or longer. And this is a difficulty sleeping every night, falling asleep, staying asleep, and it usually has a long history of this. This isn't something you have for 1 month and then maybe it goes away. It's usually reoccurring. I have a daughter who suffers from insomnia. She may go to bed at 11 o'clock at night. She'll wake up at 1 in the morning, can't fall back asleep until about 4, and then she'll sleep until 2 in the afternoon. So it affects her work schedule, her school schedule, and life, really. And it's something that she's trying to get better control of and a better understanding of. Comorbid insomnia probably is really what my daughter has. It occurs with another condition such as psychiatric symptoms of anxiety and depression can also change your sleep schedules. Certain medical conditions can either cause insomnia or make a person uncomfortable at night. Say you have a backache or you have arthritis, something like that can make it hard to sleep. So having another condition can also affect your sleep schedule. Onset insomnia generally comes on early first thing at night, meaning you're not able to fall asleep at night when you are in bed. Your first 15 or 20 minutes generally is when you will fall asleep. If it goes beyond that, that can be called onset insomnia. And then maintenance insomnia is the inability to stay asleep. So you've gone to sleep, but then you woke up at some point in the night and you're unable to go back to sleep and stay asleep. Insomnia can have certain medical disorders and health concerns that go along with it, especially if it's chronic. As you can see here on the slide, they go from serious things like stroke and seizures to maybe more mild things such as an asthma attack or sensitivity to pain. It can also induce high blood pressure, heart disease, and again, you're seeing the anxiety, depression, confusion, and frustration that go along with being sleep deprived and not getting good hours of sleep. The next one is narcolepsy, and this one is for people who kind of just randomly fall asleep. They have irresistible sleepiness, meaning like you can't control it. You're just so tired that you're gonna fall asleep. It also is combined with a sudden muscle weakness. That's a hallmark sign of narcolepsy, and it can come on by strong emotion or surprise. And people who have this will say, I've had a sleep attack where I was talking and all of a sudden I just fell asleep. Generally, it doesn't last very long, but it can be embarrassing. I mean, if you think you're in the middle of a meeting at work or in the middle of a school class and all of a sudden you just fall asleep, or maybe you walk into a surprise party, everybody goes, surprise, and that triggers that narcolepsy and you fall asleep right there on the floor. It can be embarrassing. It can affect your everyday living ability. So I actually have an uncle who has narcolepsy, and he had it happen to him when he was driving, which can be very dangerous, obviously. And he has it under control now, I believe, with medication, but it was something that really affected his life for some time, of not being able to drive or be able to maintain conversations because he was just falling asleep all the time. So definitely something you want to have looked at by a doctor. The next one you've probably heard of before on TV, and it's called restless leg syndrome. And it's characterized by this feeling of like creepy crawlies on your legs, a sensation of some pain or itchy feelings, mostly in the lower legs, and it also can come with aches and pains. Obviously, that's going to bother you to sleep. Most people, in order to make that feeling go away, they have to move their legs in some way, shape, or form while they're laying, like walking or kicking. They have found that there's abnormalities in neurotransmitter dopamine that have been associated with RLS. I personally think if I was sleeping with someone who has RLS, I would probably be having a sleep disorder too, because you'd be feeling somebody kicking and moving all night in your bed. So that could be a problem for a spouse as well. You probably have seen on commercials about restless leg syndrome and the different medications that you can take to help with that. The next one that we're going to talk about, you've probably also heard of, which is sleep apnea. This is increased sleep disorder. It's been going on for about 10 years or so, where a person with sleep apnea will periodically make gasping or snorting or snoring noises. They can also actually stop breathing for a short amount of time. So even though you realize you're sleeping 8 or 9 hours a night, you're not having productive sleep, meaning you're not really falling into those stages of sleep that give you restoration because of the snorting and the lack of oxygen sometimes. So when you realize that, you go to your doctor, say, I don't know what's going on. A lot of times they'll do a sleep study where you will actually sleep somewhere and they will record you and hook monitors up to you to see how much oxygen you're getting, how many times a night you're waking up, and you may not even realize that you're waking up because of this. If you are diagnosed with sleep apnea, a lot of times they will have you sleep with a CPAP machine, which is a machine that goes over your nose and your mouth while you're sleeping to help administer oxygen to you. And a lot of people who have this find that it has significantly increased their quality of sleep over time. So right now, let's just take a moment and with a show of hands, if you feel like that you have a good understanding over sleep disorders, please give me a 3. If you feel like, I kind of understand it, but I need some more information, I have some questions, give me a 2. And if you don't understand anything that I've been saying or really confused about something, give me a 1 so that we can review and go over the topics that you need more clarification over. Great. Now let's have a quick class discussion about if any of you are maybe having any of these symptoms or do have a sleep disorder that you know of. What is it that you are doing to help it, or is there something today that you learned that triggers maybe, you know what, maybe I do have a sleep disorder that I need to check into? Let's take about 3 to 4 minutes and discuss that as a class. And you have about 1 minute left. Perfect. Great discussion, everybody. And you brought up some good topics and good discussions to consider thinking about and moving on towards understanding sleep disorders better. I do have an assignment for you. Actually, it's going to be about a week long. As you can see here, I would like for you to log your sleep for a week, which means I need you to get a piece of paper, keep it by your bed, or somewhere where you're going to remember to fill this in. And the log needs to include what time you went to bed, so 10 o'clock, what time you woke up, say 7 a.m., and then I want you to notice how long you slept, maybe 8 hours, 10 hours, and how you felt when you woke up. Like, how do you feel your sleep was? Is it a good sleep? Is it restorative? Do I feel like I can go back to sleep? Do I feel like I need 5 more cups of coffee? What is your quality of it? So good, great, fair, poor are fine to list there. If you also list if you were awake at night, if you got up, you went to the bathroom, but you were able to fall asleep quickly, or you got up because you're hot, you were cold, there was a noise, and it took you 3 hours to go back to sleep. Let's list that as well. And then I would like for you to kind of just keep a graph, keep a chart of that for 1 week and determine how many hours of sleep you've had on average throughout that week. And then we will have a class discussion to go over that. So again, today we learned about 5 different sleep disorders, how they affect your body, how they affect your cognitive, possibly how they affect your significant other, also how they affect your life as a whole, whether you may know it or not. So thank you for your attention today, and I look forward to seeing your sleeping logs.